Vietnam stands at a pivotal moment in its healthcare evolution, where per capita spending of just 189 USD, less than half that of Thailand or Malaysia. From under-resourced facilities to sweeping policy reforms, the next 5 years will redefine how millions access and pay for medical care. Today, Vietnam's healthcare market is 21.7 billion USD, and it is set to expand at an 11.8% CAGR through 2029, according to Fitch Solutions. And now, we'll explore why hospitals and pharmaceuticals, the twin engines of this transformation, present a rare opportunity for investors. Vietnam's healthcare boom is underpinned by 4 key trends. First, a rapidly expanding middle class contrasts with per capita healthcare spending that remains well below regional peers. Second, chronic non-communicable diseases are on the rise, with nearly 200,000 new cancer cases reported in 2020 and some 5 million adults living with diabetes in 2021. Third, the population is aging quickly. By 2040, 15.9% will be aged 65 or older, driving demand for geriatric and long-term care. Finally, sweeping policy reforms, from insurance expansions to market-aligned hospital pricing, are enhancing access, affordability, and quality across both public and private providers. Public hospitals make up 77% of Vietnam's hospital network. Although the country reports 32.5 beds per 10,000 people on average, only about 13 beds meet comprehensive care standards, and private facilities account for a mere 11.9% of total beds, the lowest share in the region, with 61.8% of the population living in rural areas and local capacity limited. Many patients must travel to urban centres, resulting in severe overcrowding. While government subsidies sustain public facilities, constrained budgets suppress practitioner salaries, making it difficult to recruit and retain skilled staff. Overworked teams and outdated equipment delay diagnoses and treatment, and funding shortfalls hinder much-needed infrastructure and technology upgrades, highlighting the urgent need for structural reforms and enhanced hospital management. To address these challenges, the government plans to gradually phase out subsidies for public hospitals, aiming to encourage private sector participation. It has set a long-term goal to increase the share of private hospital beds from 11.9% in 2023 to 25% by 2050. To support this expansion, the Ministry of Health is streamlining approval procedures and accelerating licensing for both new projects and existing facilities. These efforts are intended to attract private investment, ease urban overcrowding, reduce rural-urban disparities, and enhance overall healthcare service quality. However, significant hurdles persist. In Hanoi and Ho Chi Minh City, private hospitals must compete with heavily subsidized public facilities by investing in advanced technology, enhancing service standards, and offering competitive compensation to attract skilled personnel, though robust demand among middle and high-income patients underpins growth. Meanwhile, rural and provincial regions continue to face a shortage of doctors as practitioners gravitate toward urban centers. To mitigate this, private hospital chains are expanding into areas with established medical schools such as Thanh Nguyen, Hue, and Can Tho, and investing in in-house training programs to cultivate a stable, local workforce and meet regional healthcare needs. Vietnam's pharmaceutical market totaled 6.4 billion USD in 2024 and is projected to expand at an 8.0% CAGR over the next 5 years. Generics account for 58% of sales, patented drugs 18%, and supplements the remainder. Local manufacturers currently meet 46% of domestic demand, with the balance sourced from imports. To reduce import dependency and lighten the load on public insurance, policymakers are targeting 70% local production by 2030. Supporting this goal, the 2025 revisions to the pharmaceutical and bidding laws are designed to strengthen the position of domestic drug producers, by prioritizing competitively priced local products over imported equivalents and enhancing local manufacturing capabilities. Concurrently, policy reforms are encouraging domestic firms to upgrade production standards, invest in R&D, and improve competitiveness, with the broader vision of positioning Vietnam as a regional hub for affordable drug manufacturing and exports. In the last few years, there has been a wave of foreign investors investing in private hospitals. For example, CVC Capital Partners acquired a 60% stake in Phuong Chau Hospital in 2022. Thomson Medical Group took full ownership of FV Hospital in 2023. And just last month, Quadria Capital invested in Tom Tree Medical JSC. Similar interest has driven deal activity in pharmaceuticals. Setting up a greenfield pharmaceutical manufacturing facility in Vietnam typically requires 4 to 5 years, so global firms often accelerate market entry through majority acquisitions of local drug producers. We have seen the controlling participation of Abbott Laboratories at Domesco, Taisho Pharmaceuticals at Haojiang Pharmaceuticals. The latest transaction was when SK Group acquired 64.8% of Emex Pharm in 2023, before transferring its holding to Livzon Pharmaceutical Group 2 months before. Vietnamese healthcare companies currently trade at an average PE ratio of 15.4 times, notably lower than the average of 23.2 times for regional peers, reflecting a relatively undemanding valuation backdrop. Combined with Vietnam's low healthcare spending base, a large and aging population, rising incomes, increasing prevalence of chronic diseases, and accelerating regulatory reforms with supportive policies, the sector offers compelling opportunities for both strategic and financial investors. The surge in M&A activity by global players further underscores the market's potential, positioning Vietnam's healthcare sector as an increasingly attractive investment destination.